everybody. I am Bailey Bellinger, and I'm here with my teammate, Elisa Liebeyer, and we are going to be talking to you about successful multidisciplinary team collaboration, which is a big word, so I'll probably stumble over it a few times, so give us some grace on that. So our objectives, identify and understand the roles of a multidisciplinary team and what makes them successful. Discuss methods for that successful collaboration and our specific role on that team and how our collaboration can best help. And then explore how we as child life specialists can use our skill sets or our specific special role that we talked about to help work with other multidisciplinary team members. And then from there, kind of our future directions or professional development opportunities. So first, who may be a part of a multidisciplinary team? This can be different in every setting. So in a school, it's going to be different than a child advocacy center and a hospital. So I just wanted to put a few members out there so we can be familiar with what some of those roles may be. But like I said, it would be different even in a rural setting versus a very urban setting as well. And also will depend on the developmental age of the child. It'll change when that child is born, and the members may also grow or change as that child grows up into other developmental stages. But some examples, chaplains, law enforcement, of course, us as child life specialists, therapists, school counselors, teachers, occupational therapists, speech language pathologists, audiologists, lawyers, dietitians, nurses. It can be a multitude of professionals. The important thing is that we're all there to reach the same goal for that child and family. So what is a care team? According to the American Academy of Pediatrics, team-based care is a healthcare model that endorses the partnership of children and families working together with other care providers or other roles that I previously mentioned to coordinate and address the shared goal that we have for that child and family. Right now, team-based care is considered a foundational element of the patient-centered medical home and hospital environment, as well as all of those other settings that were mentioned. There's not a ton of research about a multidisciplinary team and specifically a child life specialist role, but there is research that we were able to find that does advocate for this type of care, which we all know is the best way to care for the child and family. So who is a part of the team? Again, like I previously mentioned, it's going to depend on the setting and what is going on with that child and family. For some, if we're in a really urban setting or depending what's going on, the team may just be the primary care physician, the child, and the caregiver or the extended family. For others, this can include a wide variety of participants and surgical subspecialists, which I previously mentioned. So anyone from social workers, foster care representatives, therapists, dietitians, child life specialists, etc. The important thing is the team is paying attention to timely and accurate communication for meeting that goal of that child. And so what is our role specifically? We focus on the psychosocial needs of that child and family. So we advocate for the family-centered type of care. We collaborate with the family, the physicians, everyone on that multidisciplinary care team to come up with that comprehensive plan of care. And from there, we use our toolkit to understand the family's psychosocial needs, their culture, their heritage, and their overall experience of that healthcare or any setting that we may be working in. This is an article that we found that we really like that, again, is from the American Academy of Pediatrics that focuses on the successful multidisciplinary team collaboration. This article stresses the importance of team-based care, which we all know as child life specialists in our education and experiences. Team care that focuses on that child and family is always what's best. It's a pretty long article, but it talks about the partnership of that child and family working together and the importance of that, as well as those healthcare members and other team members across all settings having that shared goal for that child and family. The reason that a child care team is different from an adult care team focuses on three key aspects. So early environment and childhood experiences have crucial effects on lifelong health. Resources targeted toward health promotion and disease prevention have significant societal benefits. And pediatrics fundamentally incorporates the dynamic nature of childhood. Overall, this goes back to something that we may be familiar with called ACEs, or adverse childhood experiences. The more ACEs a child has when they take an ACEs test, the higher their prognosis in terms of being diagnosed with a long-term chronic illness, such as asthma, cardiovascular disease, and mental health, such as anxiety or depression. So if a child comes into the hospital, whether it's one time or for something chronic, we have that unique role and opportunity to mitigate the long-term effects of that trauma in that setting. So we can come in and use our toolkit to hopefully make that experience a little bit more positive and less traumatic for that child, which ultimately can affect their entire lifespan. So that's pretty cool that we can do that. And we can also advocate for the opportunity to do that on our care team. There's 5 key elements that this article stresses for the future directions that I want to point out. So the first is surrounding payment models. So ongoing infrastructure to better support sustain team-based care for children and families. So not something that is totally within our wheelhouse, but it's important to know that that's the future direction the article recommends. Medical school residency training and continuing medical education to incorporate principles and practice of team-based care. Pediatricians will need implementation toolkits, they'll need education, assistance, and infrastructure support to transform their practices to be more team care focused. Implementation of technology. So oftentimes a care team is brought in if there's a child that has a really unique need but doesn't have that access to a children's hospital with a care team. We can use technology to bring all of those doctors in to meet the needs of that child. Children and families should be confident that they are always at the center of care. So that's crucial, that no matter how chaotic things get or the needs of this child and family change, they always still feel like they are the #1 priority of the care team. And then communities need information and incentives to partner with pediatricians dedicated to treating children in a more comprehensive way. So after reading that, I know that's a lot of information. Some questions that I just wanted to bring up were, how can we best support children as they move through those different developmental ages, and what is our role in supporting the future directions recommended? Expanding a little bit on what I mentioned, so a care team began as the concept of hopefully a child not having to go to a ton of different appointments on different days and the family having to take off work in different days. So they ultimately decided to bring everyone that was going to be meeting that child into one room for one appointment so everyone's on the same page. That can be difficult based on the resources available. So that's where technology comes in and why this article mentions it. Here is a little bit about ethics committee collaboration. I know this isn't something that's directly implemented on every multidisciplinary team, but it may be an area that we collaborate with, so I thought it was important to include. I looked at a multitude of different children's hospitals to see what the common ground was as far as what goes on with ethics committees. So the reasons we can call an ethics committee consideration are when you're unsure about the right course of care for your child, when the child or medical team doesn't agree on a medical decision, when there's significant distress around that medical decision, and when you need help deciding about allowing a child to participate in research. According to Advocate Children's Hospital, their committee is comprised of medical experts, mission and spiritual care, nursing, respiratory therapy, social services, and surgery, but this could be different across hospitals and based on the needs of that individual family and who can request it. So a staff, so we can, the child or family can. And what I found most interesting that I did not know is that the ethics committee will never make a decision for the family. So we never need to worry about calling ethics committee collaboration because it's still ultimately going to be left up to that child and family always. So that's important. They're just there to help collaborate and process all of the decision options and what those consequences may be. So 5 basic elements of a well-functioning team: the team leadership. So someone there that's helping coordinate all of the different members and what their roles are, and then delegating the different tasks based on each role and responsibility, strengths and weaknesses, etc. Mutual performance monitoring. So each of us helping one another in our individual roles and making sure that we're all still working on that same page through those different roles. Backup behavior. So when something happens, when there's an emergency, making sure that we can shift responsibilities during those times of workload and anticipate the needs of other members. Adaptability, we all know that as child life specialists, we have to be incredibly flexible in any of the settings that we may work. So adjusting our strategy based on the changing circumstances or environment or needs of that child and family. And then team orientation, so prioritizing team goals over individual goals, encouraging alternative perspectives, challenging one another. And I couldn't help but after reading this think about, yeah, that sounds great. And I hope that I can always do all 5 of those things. But what about when it's chaotic in the ER or there's someone new in the hospital that doesn't know all of these roles? How do we continue to foster and promote this? So I reached out to 2 of my friends that are nurses, both work in pediatrics and both have worked over a multitude of settings, and asked them this exact situation. If things get crazy in the emergency room, how do I still best foster communication? And they said to always make ourselves known, make sure that our role is explained and its importance. Always introduce ourselves if there's new people and explain our role. Be open-minded, always have that mutual respect, be on the same page and explain the why behind what we're doing. So if we feel like we need a moment to help calm that child and play with them when the ED is really crazy, explaining why that's important. So going back to that trauma. We have 2 theories that we're covering. Erickson's theory of psychosocial development. So we know that Erickson's theory focuses on completing a task for each developmental stage, so they're able to successfully move on to that next developmental stage. When a child is in a hospital setting or in a foster care setting, they may not have the ability because they're in survival brain or because their health is limited to reach each of these milestones. So we have the multidisciplinary team that's still there to hopefully find ways to combat the environment or that chronic diagnosis to hopefully still meet those milestones so that child can grow up to be a successful adult. So all of the different stages have ways in which we can support them, but going into adolescence, they think, who am I? And if they're stuck in a hospital and unable to go to prom or get their driver's license, we can still work with all of the members of the multidisciplinary team to hopefully still create opportunities for them to feel as normal as possible. One of the most critical aspects coming from this theory is that as soon as the child is developmentally able, letting them be a part of their multidisciplinary team, letting them sit in those meetings, advocate for themselves, have a voice, have choice, and help make decisions regarding their own life and give them that independence and sense of autonomy. That's critical and crucially important. And then next we have Bronfenbrenner's ecological systems theory, which we know is based on a microsystem, mesosystem, exosystem, macrosystem, and chronosystem. So the interaction between us and other healthcare professionals influence that child's ability to process and cope with their hospitalization experience, and having multidisciplinary teams that kind of stretch across all of those systems working together to complete that unique goal for the child, implements effective interventions and advocate for that positive coping and the psychosocial needs of that child and family. As we all know, children are children no matter where they are, no matter what they're going through, and their number one language is that of play. So they're able to process whatever's going on and mitigate that trauma through play. So it's important that we always advocate for that medical, therapeutic, and expressive play opportunity, regardless of the setting and what's going on, because that will ultimately be in the best interest of the child. It's important that us as child life specialists are recognized, understood, and used effectively because we are incredibly powerful in that lifespan trauma that I mentioned prior. So we have a really unique role, but it's just as important and it needs to be known. I'm going to pass it on to Elisa. Thank you guys for listening.
All right, thank you, Bailey. Also, one really cool thing about that last slide was that it was, I utilized a 2019 dissertation by Bridget Diaz titled Child Life in an Interdisciplinary Collaborative Team Within a Pediatric Healthcare Setting. As Bailey was saying, there's not much research that specifically talks about collaboration within the child life setting. And so I really appreciate the way Diaz used those theories to create her framework. And she did a great job advocating for more child life specialists to be utilized in the pediatric healthcare setting, as well as recognizing that the need for more effective team collaboration with child life specialists. She explained that child life specialists have a strong child development background, and as such, it's important that child life profession be recognized, understood, and used effectively by the interdisciplinary team in order to support and promote the child's mastery over their hospitalization experience. So I will include that uh, preview dissertation in this week's folder. If you guys want to look at that, she did a really great job uh, doing a detail about those theories and how they provide deeper insight and significance to why child life is so important in the pediatric healthcare setting. But now we will talk about team collaboration and the role of child life specialists. As we know, one of the goals, essential goals of child life practice is to communicate and advocate effectively with other members of the healthcare team, which means we need to collaboratively participate in multidisciplinary team meetings and communicate child life plan of care. We need to educate the multidisciplinary team on the developmental needs of the child and adhere to healthcare policies and procedures related to verbal written documentation. So the second article that we're going to be looking at details a study titled "The Benefits of Utilizing Child Life Specialists When Dealing with Pediatric Stress." This study was very interesting because it had child life specialists as well as nurses both observe and document what they perceive to be symptoms of stress in pediatric patients, as well as comparing what they believe to be effective coping strategies, all in order to detail what they perceive to be the best effective way to reduce stress in those pediatric patients. Through semi-structured interviews, a content data analysis was performed and 6 themes were recognized and led to the identification of similarities and differences between those observations of the nurses and the child life specialists. For example, the nurses found crying to be a symptom of stress, where child life specialists reported it as an effective coping strategy. So you see there's 2 different opinions there, but they're both professional. So it demonstrates the need for collaboration between the entire MDT to be able to communicate about those varying observations and assessments to determine a clear understanding of the patient's condition, and together they can create the best plan for treatment and intervention. If they're both going on 2 different plans as far as intervention, the child will be confused and not get as effective care as they could get if they were working together as a team. Implications from this study help to identify the importance of collaborating with all available resources to obtain the best care possible for all patients, which is our best goal. Uh, Next, we will talk about the top tips on communication. One of our resources for this week is a video, and it is a link to communication in multidisciplinary teams. It highlights top tips on communication as well as communication tools in healthcare settings like the SBAR. For those of you that don't know, the SBAR is a helpful process on how to communicate important information effectively and assertively in any clinical setting. So you start by sharing the current situation regarding the patient. This is if in a scenario if you had to give an update quickly to another person in the team, or if they just needing a quick efficient update, this is a really good way to go through the information. So you start with the situation, and then you share the background of the current patient and any relevant information that they need to know right then. Share the assessment that you have already made as a professional, and then share your professional recommendation with them so they can take that information and then go forth with what they need to do in their professional capacity. So that's one way to get tips on communication, is watching that video, and it explains a little bit more. Now, there can be many barriers to communication in any type of setting. Some barriers are internal, such as language differences, one cultural's expectations, what they expect of the situation, as well as someone's past experiences. External barriers include background noise and other distractions, which, as we know, in an emergency room, there can be many distractions. The dynamic in a team environment can also affect the quality of communication. Safe and effective delivery of healthcare requires communication between individuals with different roles, training, experience, and perspectives on care. But hierarchy often can prevent people from speaking up, which has been shown to be a contributing factor to many patient safety errors because someone didn't speak up. So some ways to combat that are make sure there's two-way communication. Two-way communication includes making sure that there's a receiver and a sender, forming a closed feedback loop, thus allowing both parties to work together to achieve a mutual understanding and prevent any misinterpretations of the original meaning of the information. So this could look like making sure to talk directly to another member of your MDT instead of leaving a note for them, making sure that you convey your message and that they understand it so that they can effectively implement whatever needs to be done for that particular patient. Also, yes or no questions are likely to lead to an automatic response and to be potentially biased. So if you're needing information, use open questions such as what, where, why, how. It involves the other person more, and it means they have to think about their response instead of just giving a quick yes or no. You will be able to have more information and feel more prepared for the situation. Next, we're going to talk about communication and the role of technology. Bailey mentioned earlier, that technology is something that MDTs will have to probably use in rural settings more often than urban to make sure that we get all sorts of available uh, services to those people in rural areas. So members of an MDT can utilize technology advancements to achieve more successful collaboration and communication. Technology helps to generate new forms of information sharing as well as provide flexibility in who can access important information. When all team members do not share the same physical space, which in a modern age, a lot of the times we're on Zoom like this, technological supports can facilitate communication, such as real-time video conferencing like Zoom, or preparatory and follow-up emails, just making sure that you're having communication even when you can't talk directly in person with each other. Technology innovations offer great promise to improve communications for all team members, including children and their families. So this can look like telehealth, patient portals, secure text messaging, basically anything with technology. It can help patients access their own information, understand their procedures better, their care team, and just communicate with everyone on an easier level, as well as MDTs can utilize this as well to talk to other professionals. Next, we will explore a few of the current resources available regarding successful MDT collaboration, starting with a podcast titled MDT's What's in the Secret Sauce. This podcast provides specific insight to how multidisciplinary teams work and what research is still needed to help better leverage the combined knowledge and skills of the team. Dr. James Herbert talks about working with abused children, which is a population that as child life specialists we could work with one day. Although this is geared towards child abuse in Australia, it is still very beneficial as far as a resource about the lack of research available for MDTs and how to have successful multidisciplinary team collaboration. When listening to the podcast, I've highlighted the sections that will be most relevant to this week's topic. So again, the lack of research on MDTs and the current research on MDT effectiveness is actually very helpful. It kind of goes over how there is such a gap in MDT effectiveness and what we can do moving forward in the future to rectify that and to learn more about how to work and collaborate together effectively. as well as the barriers to service. That's another thing in that podcast. Next, we have Learn Tech Asia provided 5 ways to build multidisciplinary team collaboration. This is a resource that I found with a complete tech company. It's not child life, but it is multidisciplinary team collaboration. And I thought it was a very good, easy way to build any type of MDT collaboration. So first, we need to value each other's expertise, sorry, not experience. So you must refrain from fueling unhealthy them and us rhetoric and behavior, which we all know can happen in the workplace. You need to recognize each other's area of speciality. There's reasons that we have professionals that represent different parts of an MDT. Collaboration allows each team member to broaden their individual knowledge and perspectives as well. So you are learning more about yourself and bettering your knowledge in the process of collaboration as well. Secondly, you must forge strong relationships. This is a good way to build MDT collaboration. So adopt open communication methods within the team in order to engage in purposeful conversations, and that can lead to successful MDT collaboration. An effective multidisciplinary collaboration is only possible if people are encouraged to engage with each other in and out of the workplace. So you can't be scared to talk to your coworker if you see them in Walmart and then go and effectively help a child deal with the trauma of being in a hospital. It just doesn't work. So you have to have that strong relationship. Secondly, you need to have the right thirdly, you need to have the right communication tools. So with the growing trend of flexible work environments, cloud communication tools are increasingly indispensable. Hybrid platforms of communication that involve technology, like we talked about earlier, allows progress and updates to be accessed anytime, anywhere, regardless of time zone. Teams no longer have to struggle to collaborate, and you can advocate for all members of the care team to have access to the right tools and proper training in any technology systems used. 4, you need to have clear shared goals. So as organizations shift between work from home and work in the office, employers must clearly define the shared goals and the visions of the organization. By doing so, employees are more likely to utilize their differences in skills, training, and knowledge to accomplish their organization's goals and visions. Because people are working jointly, they feel it's safer to experiment and to take risks. You can help break down the silos that inhibit innovation, share knowledge, and come up with solutions that work across the business, saving you time and money. And finally, you have to lead by example. And this is something we can do as child life specialists. It is only possible to have MDT collaboration when leaders themselves invest and mirror it. So you have to say, I need help. I'm okay to say that I need help and I need it now, and I trust you to help me. And that's all that MDT is putting your trust in other professionals to, at the end of the day, meet your goal of providing the best care possible for your client, for your patient, client, whoever you're working with. For the discussion next week, we have provided some questions for you to think about for our Zoom. We would love for you to take this Enneagram personality test that Bailey found. It is really cool, and it is always beneficial to understand yourself more so that you can learn how you work with others and how others can work well with you. So I suggest that you do that quiz and come talk to us in the discussion, and we'd love to hear from you and what you think. That concludes our presentation, and on the last slide is all of our references. And thank you so much for your time and attention.